Prostate cancer, also known as prostate adenocarcinoma. Adeno means gland, carcinoma means uncontrolled growth of cells. So prostate cancer is a tumor which develops in the prostate gland. It only affects the males as the gland is situated only in the males, and it is usually malignant that can metastatize into other parts of the body. Prostate gland is a small gland which has the size and shape of a walnut, which sits under the bladder and in front of the rectum. The urine which leaves the bladder goes through the prostate before reaching the penis. That part of the prostate is known as prostatic urethra. Coming to the anatomy of prostate gland. Prostate gland is covered with a capsule of connective tissue and smooth muscle. The gland is divided into three zones. First is the peripheral zone, which is the largest zone, and around 70% of the prostate's glandular tissue is situated in this zone. Next is the central zone, that is 25% of the glandular tissue and ejaculatory ducts are present in the central zone. Third is the transitional zone. Around 5% of glandular tissue and the portion of the prostatic urethra is situated in the transitional zone, and which is made up of the transitional cells. Eventually, these transitional cells go for hyperplasia, that is increase in the number of cells, which causes a compression of the urethra. That condition is known as benign prostatic hyperplasia, which is normal as a part of aging. Coming to the microscopic structure of the gland tissues, each cell is covered with a basement membrane which is made up of collagen, and next layer is the basal cells along with the neuroendocrine cells. Next is the luminal columnar cells, and the inner space is known as the lumen. The luminal columnar cells secrete the substance into the prostatic fluid, which makes it alkaline and nourishes the sperm, and which helps to survive the sperms in the acidic vagina. During ejaculation, the sperm leaves the testis and goes to the vas deferens, then to the ejaculatory ducts and the prostatic urethra. When it reaches the prostatic urethra, the prostate muscle skews the prostatic fluid into the urethra, and in the urethra, the semen, the sperm and the fluid will be joined together. Semen is the fluid which is secreted from the seminal vesicle. Also, the luminal cell produces the PSA, that is prostatic specific antigen, which helps to liquefy the semen after ejaculation. So, the sperms will have easy moving. The basal cells and the luminal cells rely on the androgens, that is the male sex hormones. The androgens are testosterone, which is produced by testicles, then androstenedione and dihydroepiandrosterone produced by the adrenal gland, and dihydrotestosterone made from the testosterone by the prostate. So without androgens, the cells cannot function properly and they will go for apoptosis. Example, when we remove the testicles, the prostate gland will go for a size reduction due to the lack of androgens. Prostate adenocarcinoma is occurring as a result of genetic mutation mainly in the luminal cell or the basal cell. So the cell will divides uncontrollably. The mutation is occurring as a result of some risk factors like old age, obesity, and high fat and low fiber diet. Mutations are occurring in mainly two genes, that is breast cancer gene 1 and breast cancer gene 2, that is BRCA1 and BRCA2. These two genes also causes breast cancer among the human beings. So when mutation occurs, the cells will go uncontrollable division and forms a tumor. So in the early stage, the tumor needs androgens for the division, but in later period, the cells will keep multiplying without the androgens. And prostatic adenocarcinoma is relatively a slow shows a slow growth rate. This prostate adenocarcinoma is the most common type of prostate cancer, but some other types are existing, like transitional cell carcinoma, which originates from the transitional zone, and small cell prostate cancer, which originates from the neuroendocrine cells. Early stage of the adenocarcinoma does not exhibit any symptoms because most of the tumors are occurring in the posterior peripheral zone and the urethra is far away from the posterior peripheral zone. So when the tumor enlarges, it may compress the urethra or bladder, which causes difficulty in urinating, bleeding, pain while urinating and ejaculation. Also, if the tumor gets metastasis and spread to the bones like vertebra or pelvis, there may be hip or lower back pain for the patient. Coming to the diagnosis, the digital rectal examination is the main diagnostic method for prostatic cancer. So, in case of posterior prostate, if the tumor is present there, we can feel a hard lump while doing the digital rectal examination. If the tumor presents elsewhere like anterior peripheral zone, the tumor is out of reach. Also, we can go for a transrectal ultrasound or MRI. The prostate cancer also produces prostatic specific antigen. Also, we can go for a biopsy to identify the presence of prostate cancer. In biopsy, we are going for a Gleason grading system. So here we are going for identifying two common cell pattern, like we are scoring the grading system from 1 to 5. 1 means normal well differentiated cells and 5 is abnormal cells present in the prostate. So we will go for 2 scoring and we will add the score and total Gleason score will be from 2 to 10. 2 means in that 2 is the normal and 10 means it is abnormal complicated cells. Coming to the treatment, if the tumor is confined to the prostate and does not metastasize, then there will be active surveillance. In that we will go for a routine tumor marker measurement and imaging. So we are doing this to ensure the cancer is remains confined into the prostate only. If the tumor spread to the other parts of the body, we can go for a surgery, radiation therapy, chemotherapy or hormonal therapy. Coming to the quick recap, prostate cancer is usually known as prostate adenocarcinoma. It is usually occurring in the posterior peripheral zone of the prostate. The diagnostic method is by digital rectal examination and level of prostate specific antigen. Treatment include chemotherapy, radiation therapy and hormonal therapy in case of metastasized tumors and active surveillance when the tumor is localized to the